In today's medicine, we are going to look at a paper for May 2022. We'll go straight to look at the multiple choice. And question 1 says, which one of the following is not a classification of dehydration? The answer is A, which is moderate dehydration. We go to question 2. Question 2 says, Mr. Mwanza explains that he has been passing foul-smelling stools that are soft and bulky and difficult to flush and may float or stick to the side of the toilet bowl. What is the most likely diagnosis? The correct answer is C, which is malabsorption syndrome. Question 3. Which one of the following antiretroviral drug is not a non-reverse transcriptase inhibitor? The correct answer is D, which is atazanavir. Question 4. Which one of the following drug is associated with renal toxicity? The correct answer is C, which is tenofovir. 5. In Zambia, the screening test for HIV is the correct answer is determine, which is A. 6. In which one of the following modes of transmission can hepatitis B be spread? The correct answer is B, which is through blood transfusion. 7. When migraine has been diagnosed, the goal of nursing management is to. The correct answer is A, which is enhanced pain relief. 8. Complications of an epileptic attack include all of the following except. The correct answer is D, which is malabsorption. 9. Which infection is associated with Katayama fever? The correct answer is C, which is schistosomiasis. 10. Causes of meningitis include all of the following except. The correct answer is, of course, D, which is Plasmodium falciparum. 11. An abruption in renal function results in a rise in serum. The correct answer is A, which is creatinine. Question 12. An immune-mediated progressive demyelinating disease of the central nervous system is. The correct answer is B, which is multiple sclerosis. 13. In renal failure, renal parenchymal changes due to disease or nephrotoxic substance is classified under. The correct answer is B, which is intrarenal causes. 14. An assessment technique involving the production of sound to obtain information about the underlying area is. The correct answer is C, which is percussion. We go to 15. All of the following are predisposing factors to brain abscess except. The correct answer is, of course, A, which is pulmonary embolism. 16. Hyperthyroidism refers to. The correct answer is B, which is increased level of thyroid hormone in the blood. 17. The following are all blood disorders except. The correct answer is B, which is heart failure. 18. Which of the following does not belong to polymorphonuclear leukocytes? The correct answer is A, which is monocytes. 19. In cholera, electrolyte imbalance may lead to the following except. The correct answer is A, lethargy. 20. To monitor the renal function in the adult patient with cholera, the nurse should. The correct answer is C, which is catheterize the patient. 21. Providing warmth to a patient who is dehydrated is done to. The correct answer is A, prevent shock. 22. Which of the following is not a common site of peptic ulcers? The correct answer is A, which is pancreatic. 23. Inflammation of the small intestines is known as. The correct answer is C, which is enteritis. 24. The most important therapy for the patient with acute diarrhea caused by viral infection is 2. The correct answer is B, which is increase fluid intake. 25. Which one of the following interventions is the most potent and sustainable way of controlling the spread of COVID-19? The correct answer is, of course, B, which is vaccination. 26. Epidemic control of COVID-19 is attained when the positivity rate is sustainably maintained at. The correct answer is A, below 5%. 27. A patient with genital ulcers syndrome is given acyclovir, which sexually transmitted infection is targeted. The correct answer is A, which is herpes simplex. 28. Heart palpitations in anemia results from. The correct answer is B, which is tachycardia. 29. Thrombocytes are involved in. The correct answer is C, which is blood clotting. 30. Which of the following health promotion activities should the nurse include in the discharge technique plan for a patient with asthma? The correct answer is A, which is incorporate physical exercise as tolerated. 31. An increase in the number of eosinophils in the blood occurs in response to. The correct answer is C, which is parasitic infections. 32. The other name for shingles is. The correct answer is C, which is herpes zoster. 33. Congestive heart failure is also known as. The correct answer is B, which is left-sided heart failure. 34. The right-sided heart failure accounts for the following except. The correct answer is D, which is pulmonary edema. 35. Which one of the following investigation is not done to rule out anemia? The correct answer is A, which is blood gas analysis. 36. Ascariasis can be treated with. The correct answer is, of course, C, which is Vemox, 100 milligrams twice daily for 3 days. 37. When is the pain felt in duodenal ulcers? The correct answer is C, which is 2 hours after meals. 38. Eating disorders associated. Eating undercooked meat product will cause. The correct answer is B. The correct answer is D rather, which is tapeworm. 39. The period when the patient is asymptomatic, organism multiply, and host defenses are triggered to encounter the infection is called. The correct answer is B, which is incubation. 40. In children, inflammation of the meninges causing blockage to the flow of cerebrospinal fluid may result in. The correct answer is A, which is hydrocephalus. 41. Which one of the following is the most appropriate diagnostic procedure for meningitis? The correct answer is D, which is lumbar puncture. 42. Localized dilatation of an artery resulting from a weakness in the arterial wall is called. The correct answer is D, which is aneurysm. 43. Which one of the following conditions should the nurse consider when nursing a patient with meningitis? The correct answer is A, which is dim light room. 44. All of the following are characteristics of diabetes mellitus type 1 except. The correct answer is D, which is gradual onset symptoms. 45. Characteristics of the Mycobacterium tuberculosis include all of the following except. The correct answer is D, which is survives in anaerobic condition. 46. During a physical examination, the nurse assesses a patient's posture, stature, and body movements. Which type of examination technique has the nurse used? The correct answer is B, which is inspection. 47. Genetic disorders arising from inherited traits include all of the following except. The correct answer is B, which is lymphoma. Food handlers, 48. Food handlers are most likely to transmit. The correct answer is B, which is salmonella. 49. Which one of the following conditions may not predispose to a sickle cell crisis? The correct answer is D, which is somnolence. 50. The medical term for vomiting of blood is, the correct answer is A, which is hematemesis. We move on to matching questions, and the first set of matching says match the terminologies in column 1 with their meaning in column 2. And 51 says xerostomia. The answer is C, which is dryness of the mouth. 52 apnea. The correct answer is D, which is temporal loss of breathing. 53 rhinorrhea. The correct answer is F, which is excessive discharge from the nose. 54 aphonia. The correct answer is A, which is loss of voice. 55 hyperhidrosis. The correct answer is G, which is excessive perspiration. The next set of matching says match the medicines in column 1 with their appropriate indication in column 2. 56 says morphine. The answer is D, which is severe pain. 57 losartan. The correct answer is E, which is hypertension. 58 salbutamol. The correct answer is B, which is asthma. 59 chloramphenicol. The correct answer is C, which is meningitis. 60 tagamet. The correct answer is A, which is peptic ulcer. The next set of matching says match the items in column 1 with their appropriate disorders they may cause in column 2. 61 says viral. The correct answer is E, which is common cold. 62 protozoa. The answer is F, which is toxoplasmosis. 63 malignancy. The correct answer is A, which is leukemia. 64 fungal. The correct answer is C, which is pneumocystis carinii pneumonia. 65 bacteria. The correct answer is G, which is pseudomonas. The last set of matching says match the disease in column 1 with the appropriate etiologies agent in column 2. 66 says genital ulcers. The answer is D, which is human papilloma virus. 67 filariasis. The correct answer for 67 is A, which is Wucheria bancrofti. 68 lymphogranuloma venereum. The correct answer is F, which is Haemophilus ducreyi. 69 pork tapeworm. The correct answer is G, which is of course Tinea solium. 70 herpes zoster. The correct answer is C, which is varicella zoster. 71, we move on to completion, and we are starting with 71. 71 says the type of sound described as drum-like, loud, empty quality felt over gas-filled stomach, intestine, or pneumothorax, which is heard during percussion, is called. The answer is tympanic. 72. In renal failure, urea is excreted in sweat and crystallizes on the skin to form. The answer is uremic frost. 73. A condition of the lung characterized by collapsed airless alveoli is called. The answer is atelectasis. 74. Dash is the narrowing of the arteries due to accumulation of fatty materials. The answer is atherosclerosis. 75. Dash is the permanent and abnormal dilatation of one or more large bronchi. The answer is bronchoectasis. 76. The term used to describe low calcium level in the blood is. The correct answer is hypocalcemia. 77. The drug of choice for treatment of severe malaria is. The correct answer is artesunate. 78 rather. A person who has been located as late or lost to follow up and chooses not to return to care is. The correct answer is lost to follow-up or defaulter. 79. The insertion of the needle through the chest wall into the pleural space to obtain a specimen or remove fluid is called. The answer is thoracentesis. 80. Dash is the asexual phase of the... Okay, so we are saying 80 dash is the asexual phase in the life cycle of malaria parasite taking place in the mosquito. The answer is sporogony. 81. The standard dosage per kg body weight for praziquantel in adult is... The answer is 40 milligrams per kg body weight. 82. The nursing action that should be taken before giving a digitalis is to check the answer is to check the apical pulse. 83. The test used to diagnose of liver condition and also monitoring the toxic effect of some drug is called... The answer is liver function test. 84. A chronic non-specific inflammatory bowel disorder of unknown origin that can affect any part of the gastrointestinal tract is known as... The answer is Crohn's disease. 85. Lymphogranuloma venereum is a sexually transmitted disease caused by a bacterium called... The correct answer is Chlamydia trachomatis. 86. The inflammation of the tonsils is known as... The answer is tonsillitis. 87. A period from the time infection until an antibody test is positive is known as... The answer is Windows period. 88. A situation when a treatment regimen is no longer able to sustain viral suppression and consequently is unable to control the HIV disease is called... The answer is treatment failure. 89. A tumor arising from the melanin producing cell is known as... The answer is melanoma. 90. The increased concentration of red blood cell is called... The answer is polycythemia. 91. An instrument that is used to elicit deep tendon reflex is called... The answer is percussion hammer. 92. The position which is suitable for examination of the rectum and vagina is... The answer is lithotomy. 93. All new tuberculosis patients are treated under treatment category 1. 94. Dash is the examination of the esophagus using endoscope. The answer is oesophagonoscopy. 95. The medical term for coughing out blood sputum is... The answer is hemoptysis. 96. The seizures that persist for at least 30 minutes or is repeated so frequently that recovery between attacks does not occur is called... The answer is status epilepticus. 97. The commonest cause of cyanotic congenital heart disease is the answer is tetralogy of Fallot. 98. Cholecystography is the radiological examination of the answer is gallbladder. 99. The drug of choice for treatment of shigellosis is... The answer is ciprofloxacin or cotrimoxazole. 100. An examination technique of the body tissue and organs using the sense of touch is called... The answer is palpation. So that is how we can answer the questions in the May 2022 paper. And this paper had questions from renal failure, it had questions from iron deficiency anemia, and it also had questions from schistosomiasis. So till next time, this is where we end. Goodbye.